So before I would enter the room, I would look at their health records. Then I would knock on the door, enter, provide privacy, introduce myself. Then I would perform hand hygiene. I would get 2 identifiers, their name, their date of birth. I would tell them I'm going to do a dressing change on their wound. Ask them their pain level on a scale from 0 to 10. For this case, I'll tell they said a 2. I would give them pain medication 30 minutes before the procedure. Then I would put on my gloves, clean gloves. I have all my equipment in my biohazard bag. I would go over to the wound on their right foot, on the ventral heel. Take off the wound slowly. Look at it. See if there's any drainage. For this case, we'll say there's a small amount of serous drainage. I would then throw it away in the biohazard bag. Examine the wound. Edges appear to be well approximated. No erythema, no swelling, or no abnormal swelling. There appears to be 1, 2, 3, 4, 5, 6 sutures with some type of tie in the middle of the heel. And then I would get my measuring tool, measure the length and the width from the longest point. So the length without touching the heel. So the length is exactly 8 centimeters, and the width appears to be exactly 1 centimeter. So then I would set this aside, take off my gloves, throw them away, perform hand hygiene again. And then I have a bigger pair of extra sterile gloves. Then I have my wound tray kit. I would take my sterile gloves, open them up, only touching the 1-inch border, keeping my gloves sterile. I will grab my right glove, pinch and pull it up, keeping it sterile. Then I will grab the cuff with my 3 fingers, thumb out, slip my hand in. Put that up. So now my hands are sterile and I can put them on, make sure they're tight, and this my sterile field will be this. So then I will open up the kit, take everything out, put it on my sterile field, not putting it on my 1-inch border. And this is all sterile now, so I would put my tray here. I would dump my saline in my tray. I would grab gauze, dip it in the saline, come over to the wound. I would do 1 swipe, the cleanest part of the wound, throw it away, grab a new gauze. Pat with saline, come down, clean the wound and the cleanest part out. Grab another gauze, get a little bit of saline. I would wipe on the outside of the wound. 1 swipe, discharge. Grab another 4x4 gauze, saline on the other side of the wound, and then throw away. So now I applied saline to the wound, and now I am going to pat dry with gauze. Still from the cleanest part of the wound, which is in the middle. Throw away. Pat dry. Other side. Throw it away. Pat dry on the other side. Throw it away. So now my wound is dry and clean. I would then put 4x4 gauze on it. Put it over the wound. I would grab my tape. Try not to let it tape to my gloves. And in a real scenario, I would wrap the bandage around the heel. Tape. So now the bandage is on there. I would discharge of my sterile gloves because I don't need them anymore. I would grab a pen, which would have been handy to have. Put a sticker on the wound and sign it, the date and my signature and the time. And so now I don't need anything, so I could put it back in the tray, discharge, and that is it.